Hello everyone, my name is Nandini Sarvade. I am a physiotherapist. I did my bachelor's in physiotherapy from MS University in Baroda, and I have my postgraduate diploma in rehabilitation from All India Institute of Physical Medicine and Rehabilitation in Mumbai. I did my master's in physical therapy from New York University, specializing in developmental disabilities. Today, I'm going to talk about autism and primitive reflex integration. So, we will talk about what happens when primitive reflexes are active or retained or are unintegrated. What are primitive reflexes? What is cold laser? What are the conditions treated with low level laser therapy and others? So, primitive reflexes are inborn in our bodies and they are present, they start working at the time of birth. They are involuntary reactions that a child will react to stimuli like a touch, sound, movement, or even temperature. So these primitive reflexes help with survival and protection during the first few months of life. And some of these reflexes, like Moro, ATNR, Bowel crawling, and others, help the fetus to go through the birth canal during delivery. Another function of the primitive reflexes is to teach the child to do different activities reflexly at first and later on to start doing it voluntarily. So, the development of higher brain centers that control muscle tone, movement, sensory integration, cognition, and learning skills all are also possible because of these primitive reflexes. Now, the primitive reflexes are supposed to stay for a few months and then get integrated into the system of the body. If they remain unintegrated, they are there is a weak or incomplete connection. So what happens is that the primitive reflexes continues to keep on acting even when the child is older and adult, and it disrupts communication between the different systems of the body. Now, some of the symptoms of unintegrated reflexes that we see are toe walking, not having eye contact, low body muscle tone, anxiety, hyperactivity, attention problems, speech disorders, sleep issues, bedwetting, posture, abstract thinking, handwriting difficulty. These are just a few that I'm naming here. And some of the diagnoses that we see which have unintegrated reflexes are autism, ADD, ADHD, dyslexia, cerebral palsy, even Parkinson's and hemiplegia, and others. Here is a picture of a baby showing the Moro reflex. So from 0 to 3 or 4 months of age, the babies display Moro reflex, which is normal because it is helping the baby to survive. But what happens if it does not get integrated after the 3 or 4 months? What happens is that the baby will stay in the flight or fight reaction state all the time. Any slightest sound will disrupt the baby or startle, and they have even difficulty staying asleep. Then, as the child grows, then you see that there are visual problems, difficulty catching a ball. Like on the playground, they will have all these difficulties. In the classroom, they will have a problem focusing on details or copying from the blackboard. They will also have vestibular challenges, poor balance, and coordination. And an adult with a Moro reflex that is unintegrated will show signs of living in constant stress And whenever this reflex is elicited, even like firecracker going off or some startling sound, they will go they will go and show the Moro reflex. And another thing is that because the Moro reflex is making the person stay in constant fight or flight state, the cortisol is being released in the body. And because of that, the immune system of the person gets affected. They catch a lot of infections and their immunity is compromised. A fear paralysis reflex is another important reflex. It appears at 5 to 7 weeks while still the baby is not born, and it gets integrated by 12 weeks in utero before the baby is even born. So, why is this reflex important? Because when the mother is in some danger or under stress, when the cortisol is released in the mother, to stop that cortisol from reaching the baby in the womb, the fear paralysis reflex makes the baby go into a frozen state so that the cortisol does not enter the baby's bloodstream. But if for some reason the fear paralysis reflex does not get integrated before birth, then the child is born with the fear paralysis reflex intact. And then there are a lot of difficulties that we see, like difficulty making eye contact, dislike of change, low stress tolerance, avoidance of confrontation, eating disorders, fear of separation, expressive language disorders, hypotonic muscle tone, shallow breathing, hypersensitivity to touch, light, sound, all of these. And with the children who have a diagnosis of autism or ADHD, OCD, we will see that the fear paralysis reflex is not integrated. Here is a picture of a hand grasping reflex, which should also again get integrated. And when it does not get integrated, then in the child we see when they are starting to write, uh, holding a pencil pen in the hand and writing is very difficult for them. So the hand grasping reflex is integrated. The Babinski reflex we see here. And here is a list of reflexes that I work on when I work for reflex integration. So the Moro reflex is the first reflex which appears and it's supposed to get integrated. Then the spinal reflex is the second reflex. This is a list of reflexes which we start from the first one and then we end, and they are supposed to get integrated in that order. Some of the causes of unintegrated or retained reflexes in children when the mother is under a lot of emotional or mental stress during pregnancy. That is a very important cause. And also traumatic birth events like a C-section, forceps birth, or breech birth, you would see some retained reflexes happen. Insufficient activity and insufficient natural movements. What do we see nowadays? A lot of kids are put in car seats or in swings in their homes where they are not able to get out of it. They are not able to get on the floor and move around, crawl, or things like that. People even put their babies in fancy walkers. If like a 1 year of age and the child is not walking, they put them in a walker to help them to walk. But what happens is that the there is a spot where the child is supposed to go from one reflex to the other, and that is stopped because the child is standing already in the walker, and the integration of the reflexes is delayed or even stopped at that point. Also, genetic abnormalities is one of the causes for retained reflexes in adults. Now, what happens that yeah, for adult, who already is a good functioning normal adult and with not too many problems of retained reflexes. But during life, they come under a lot of stress, or if they have a fall, or emotional trauma, brain injuries, physical trauma due to some fall or accidents, even going under surgeries, major surgeries, or toxins that they get through food or drink, or things like that, can cause the reflexes to become unintegrated in adults. So, this is also seen in adults. So, what are the drawbacks of unintegrated reflexes? So, in adults and teens who have a few reflexes that are unintegrated, and then they are able to function somehow, what happens is that they have to learn to compensate for these difficulties. But in doing so, in doing the compensations, it requires a lot of effort and energy that they have to put in to do simple things. And this results in frustration, physical exhaustion, and low self esteem. So, one example would be like somebody that does not sit up straight and is always, the posture is bad. So, the parents keep on telling them, oh, sit up straight, sit up straight. And yes, the child will sit up straight, but while he's thinking, he can sit up straight. But as long as suddenly, when he stops thinking about that, he will go back into the posture. So this can be addressed also. This could be because of one of the reflexes which were not integrated well. So this is just one example. And then what happens is that some of the reflexes which are not integrated well will put stress on the neck, on the cervical spine. So these people can get neck pain. If there are a few reflexes that are working on the spine and they are not integrated, then there could be a scoliosis, scoliotic back is seen. There can be low back pain. There is abnormal gait. They don't walk properly. There is a hip rotation so that they don't walk straight, they are a little crooked. And for some people, we can see that their ankles are easily sprained as they walk. Some we see walking on the inside of the foot, or some people walk on the outside of the foot. And there are chronic body aches, there are difficulties with balance and coordination, clumsiness, and the diagnosis like cervical spondylosis, low back pain, sciatica, osteoarthritis of knees, hips, and ankles, all of them can be connected to unintegrated reflexes on evaluation. As a physiotherapist, when I do evaluation of my patients with the above diagnosis, many times I see that they do have unintegrated reflexes, and when these are treated, they get better. Also, motion sickness, hypo or hypersensitivity to vestibular input, that is also due to unintegrated reflexes a lot. And so here I was going to also tell you that for these reflexes to get integrated, I have found that using the low level laser therapy is the one of the best methods so far. I have worked with also methods in which we do reflex integration using exercises for each reflex, but it is very difficult to get the participation and cooperation of children with autism to do all these exercises. And also, this method of using low level laser therapy is much faster, more efficient than our regular traditional therapy, and also the reflex integration using exercises. So here is a diagram of the mechanism of action of low-level laser therapy at a cellular level. So as the light enters the cell, this is the mitochondria which absorbs the light, and this energy is then used to increase ATP and all the other processes that are inside the cell become faster and more efficient. And the equipment that is used for low-level laser therapy has got red laser diodes, violet laser diodes, and infrared laser diodes. And each one of them has different beneficial effects. Also, there is a frequency sweep generator. It is a machine that produces sound waves and has infinite frequencies. And these are very beneficial and therapeutic for the body. They also help with reflex integration. And if you listen carefully, you will be able to hear that there are 10 octaves that the sound goes through. Now we see the beneficial effects of low level laser. So, low level laser has been used for a long time, like 60 years or so, for different treatments. Now, what the low level laser does physiologically, as I showed you earlier, ATP production increases, inflammation in the body decreases, digestion improves, the immune system starts improving, there is nervous system repair, and there are also cosmetic uses to improve the skin appearance, acne and wrinkles removal. Wound healing is also a major use of low level laser. Diabetic foot ulcers, which are so difficult to heal, have been shown to heal very well completely using low level laser. There are a lot of studies done to show this. Now, I would like to share some of my success stories with you. I was working with a 4.5-year-old boy with a diagnosis of autism spectrum disorder. He was also toe walking, and after therapy, he improved so much. Like his speech also improved. He did not have very clear speech earlier. His speech improved. His toe walking went away, and he started walking normally. He even started doing a lot of uh, different activities because he was not toe walking anymore. His attention improved very much. Even in the school, his teachers commented on that. He was able to sit down and start writing and reading. His eye contact improved, and the quality of life of this little boy and his whole family improved very much. And then here was a 6-year-old boy with ASD, hyperactivity, dyslexia. So he could not read anything at that time. His mom had enrolled him in a Tai Chi session. So it would be like a one on one session with the teacher because he was so hyperactive, he could not be in a group to learn Tai Chi. But for him also, so much improvement happened. Like within a few sessions, his teacher said the Tai Chi teacher was his. The mom said that the Tai Chi teacher was very happy with his progress and had put him in a group class now because he was able to attend and focus so much better. He started reading well. His mom said that now you cannot even stop him reading because he likes to read so much. He's reading a lot. His hyperactivity went down. He was able to sit better in class, focus and attention. And even after 1 year that I checked on him, the mom reported that he is doing better and better in school. And he's making friends, and wonderful. His brother and parents are thrilled with his progress. There is another one I had. I worked with an 8-year-old boy with autism, and he had a lot of anxiety. He could not even sit in one place to do anything because he was so afraid all the time. He could not sleep well. He had not slept continuously in his little life of 8 years. But with this therapy, with reflex integration, the first important change that his mom reported was that he started sleeping through the night. And with this little boy sleeping so well, the parents could sleep well and everyone could get a good night's sleep. Then slowly his anxiety started going away and he was able to be more at peace and able to attend to everything. And then he started improvement in his speech. So this was a very successful case of reflex integration. I had a 15-year-old boy in high school. He was a higher functioning boy, but he had a lot of difficulty understanding what the teacher was teaching in school. And he had to work very hard at home because he could not learn in the classroom. For him, also, the reflex integration with the lasers helped him so much that he was able to tell me and his parents that now he found it very easy to learn and study in class. He was able to focus and get all the subject matter that the teacher was teaching. Even his parents reported that he was in the social circles that they moved. He was able to communicate without much stress with other children. He was able to make more friends. And there are a lot of other success stories because, in my experience, everyone that I work with to do reflex integration with laser therapy, it helps them in one way or more ways in their life. It improves the quality of life of everyone, the patient, the parents, grandparents, everyone. Okay. Okay. So another thing that I wanted to tell you was that once the reflex integration has started happening in the children, it just continues to grow. Like it is like starting a process, and then the body takes over and it continues to get integrated. And with children, what happens is they continue to play and run and do all the activities. So like in normal children where the reflex integration is happening as the babies are crawling and running and walking and everything, in the same way with the children that I work with for the reflex integration, there um, once the reflex integration has started and gone to a good level, it will just continue to get better, and their development also progresses. It just continues going like a regular, normal schedule. Okay, here is a little study that I did with 5 children with ASD, and they were treated with 10 sessions of low-level laser therapy. I had given the parents a questionnaire to fill out before the treatment started, and then one after the 10 sessions. And a software was developed to calculate the integration levels according to the symptoms that were present or not. So what I saw that the Moro reflex and fear paralysis reflex showed statistically significant improvements after treatment. And that was very um, impressive to see that it is so efficient. So the efficacy of this low-level laser therapy was really proven in a small group. More needs to be done, but right now we see that the Moro reflex had a um, P of less than 0.05 and the fear paralysis had less than 0.01. Here are other applications of reflex integration using low-level laser therapy. In an 81-year-old woman with a right-sided stroke that she got 6 years earlier, when she was treated for this reflex integration, her balance improved, In standing, she was started walking better with the cane. She did not need anyone's support. Before treatment, she needed somebody to hold her while she was walking with the cane. But just in a few sessions, her walking improved, the volume of her voice improved, that you could hear her around the house. Earlier, she used to walk in a whisper, and she started walking so well so that she was enthusiastically walking around her home. And also, she walked across the hall to her neighbor to see them. So it improved her physically and emotionally and socially. She was able to go on her own and meet the neighbors. Another one was a 76-year-old woman. She had a lumbar spondylolisthesis and she had to wear a belt. She couldn't stand long enough at home to do her cooking, and she walked with a limp because of the pain. So, after one protocol in which I worked on all of her 18 reflexes, she improved her gait, she felt more energized, and she reported that she felt 10 years younger. And also, her walking around, like she started walking for exercise after this. So, that was a big improvement for her. And then I had worked with an 80-year-old man with Parkinson's. And for him also, when I evaluated him, I could find his reflexes that were now unintegrated due to the Parkinson's disease. And after treatment, his right leg tremors decreased so that he was able to walk better. Earlier, he couldn't write well with his right hand, so that also improved. And his voice also, and the volume of his voice also improved, and the clarity of his speech improved. He was starting to develop dysphagia, which is difficulty of drinking water. So that also improved for him. Now, there is one study done here showing the efficacy again of low level laser therapy in autism spectrum disorder. They had studied 40 students from the age of 5 to 17 years, and they had a checklist of 4 different behaviors: global, irritability, lethargy, and stereotypic behavior. And they had them fill it out. And they showed a lot of improvement, which continued even after they had stopped therapy. So I also have a lot of references here, studies done to show the effect of reflex integration and laser therapy. If you have any questions, you are free to email me or send me WhatsApp messages. Thank you.